Hello and welcome to Happy Feet Movement. Tonight we have a speaker talking about the strength in movement, the role of exercise during your cancer journey. So we have Dr. Melanie Potiaumpai, and she is going to share a lot of her wisdom and knowledge. Just to share a little bit about Dr. Potiaumpai, she is an assistant professor at the Department of Medicine at the University of Pittsburgh at UPMC Hillman Cancer Center. She is also the co-director of the UPMC Moving Through Cancer program. Her research focuses on the role of using exercise to improve physical, functional, and psychosocial outcomes before, during, and after treatment, and providing resources to people living with and beyond cancer to help prepare for and recover from treatment. So she's a wealth of knowledge, and she and her team are going to be joining us every Thursday. So and I did, in the email that I sent out today, there was some information of things that you'll need for Thursday. So if you didn't get that or need me to send that again, I'm happy to do that. But I am now going to turn it over to Dr. Melanie to share the importance of exercise.
All right, I'm going to share my PowerPoint. Give me one moment. Okay, I'm hoping I shared correctly and everyone can see everything.
Yes.
Wonderful. All right. So like Jen said, today we're going to be talking about strength and movement. So how can exercise help you during your cancer journey, whether it's before, during, or after, or, way after, depending on where you are. So I'm very excited and very delighted that I was connected with Jen and Cancer Bridges. I'm relatively new to the Pittsburgh area. I've been at UPMC for about a year now. And like Jen said, I am the co-director of the Move to Cancer program. And a researcher. So that's my main job as a scientist, is developing clinical trials and figuring out the best way to use exercise to help people essentially get back to their everyday life and to manage their symptoms, and then figuring out how can we integrate exercise into your daily life. I think exercise, and I might be a little bit biased, is one of the hardest lifestyle changes for a lot of people, just because at its core, exercise is hard and it can be uncomfortable. And there's so much information out there in the ether, on the internet, in books, on TV, everywhere, where everyone has an opinion about exercise, whether they're an expert or not. And so it can be a little bit confusing, and it definitely is intimidating. Even as an exercise physiologist who does exercise regularly and studies exercise, there is just so much information that I have to sift through. So I can't even imagine for someone who doesn't, regularly come in contact with exercise. So the way that I like to do these kind of presentations when I present to the non-scientific community, meaning, patients, survivors, caregivers, and those who are just interested in exercise, is I like to approach exercise in a more pragmatic manner. So I'll talk a little bit about the evidence, scientific background and the point of exercise and, what you'll get from it. But there's, other presentations, specifically on the Cancer Bridges YouTube website, that you can go and find the more scientific explanation of exercise, and it's all very interesting. But I didn't want to repeat that because that's already up there for you to view. So I'm going to go just a little bit about the background, but then I really want to get into the practical side of exercise, give you more tips to actually get started, and to understand why we do the things that we do for exercise. And if you have any questions, I encourage you to either put them in the chat or write them down, so that maybe at the end, if we have some time, we can go over them one by one. And I encourage you to also use the private page that Jen was also advertising as well. So I have a staff member of mine, her name is Adeline Farrington, who will be leading the exercise sessions on Thursdays. She and I will be monitoring that page. So if you have a specific question about exercise and you want to know before you can get to the Thursday session, please put that on the page and we will check about 1 to 2 times per week. And there we can provide a more detailed answer for you. And then others can view that question as well, because I find that a lot of people tend to have overlapping curiosities and overlapping questions about things. So something that you might have a question about might be what someone else has a question about. So I encourage you to kind of make it more interactive, and we want to make sure that we're accessible to you. Okay, so that was a long introduction. So let's go ahead and jump right into it. Let's see if this works. All right. So the first thing I want to do is to really describe what physical activity and exercise is. So this is one of the main things that we encounter, especially in research concerning exercise, is that we ask someone, how much do you exercise? And then they'll tell us an answer like, well, that's not exercise. And they'll be, yes, it is. I'm moving my body. I'm getting up out of a chair and I'm doing this one thing. And that's certainly true. Like Jen said, some movement is better than no movement at all. But it's important to decipher what is physical activity and what is exercise. So physical activity is any bodily movement that you use your muscles to do and it requires energy to do it. It could be during your leisure time. It could be getting from one place to another, transporting yourself, or it could be part of your work. So an occupational physical activity, you're walking in and out of the kitchen, or you're walking around the office, or if you do physical labor, that's physical activity. So examples of that are gardening, cooking, going to get the mail, walking the dog. Those are all examples of common physical activities that we do around the house or outside. Versus exercise. So exercise is a type of physical activities, but it's planned, it's structured, and it's repetitive, meaning that we set aside time, we're going to go and do this thing, and we're going to do it based on this program that we have put together for ourselves. And the goal of exercise is to either maintain or improve some type of physical fitness component. And I'll go a little bit into what those physical fitness components are. But exercise, like I said, is not for the purpose of just getting things done. It's for the purpose of we have a physical fitness goal, and we're going to go ahead and do exercise to reach that goal, maintain that goal, and then improve on that and get a new goal. Okay, so I kind of want to keep that in mind as we talk about exercise. And as you do an inventory on yourselves in terms of, am I getting enough exercise? Think about what you're doing during the day. And now you can categorize, oh, that's actually not exercise. That might be physical activity. How do I kind of shift from one, transition point to another? All right. All right. So we talked a little bit about the physical fitness components. In exercise oncology, so that's exercise in the cancer field, we tend to look at exercise and prescribing exercise in 5 different components. So the first is aerobic exercise. And you might know that as something that is repetitive, increases your heart rate, running, jogging, cycling, swimming, anything that increases your heart rate at a steady motion. The next is strength exercise, or you also might know it as resistance training or resistance exercises. And that uses some type of weight, either your body weight or external weight like a dumbbell or a resistance band. And that is to increase the muscle strength. The third component is flexibility and range of motion, right? So you might see that as like stretching. Some Pilates could be considered flexibility and range of motion. Yoga is another one that, we consider for flexibility and range of motion. The fourth is balance training. So yoga is another one that's great for that. You might be familiar with Tai Chi or Qigong. That's also for balance training as well. And then the last is rest and relaxation. So a lot of people are very surprised when they see all of the 4 different types of exercise components, and then they see rest and relaxation. We really try to emphasize in exercise oncology, especially if you're going through treatment or have just recently completed treatment, that your body really does need to rest to be able to make the improvements that you expect to see from the exercise. So if you're consistently exercising and not giving your body enough time to recover and make those positive changes, you're actually doing more damage to your body than any good. So if you give yourself time to rest and relax, you'll see those changes that you expect from exercise much quicker. And especially if you're on treatment or just recently completing treatment, rest is very essential to be able to have the gas in the tank to be able to do exercise. So if you're tired because you're not giving yourself any time to relax or rest, you're not going to be able to do the exercise, which defeats the whole purpose of having an exercise program. All right. So I want to go into a little bit about the guidelines of exercise. You might have heard them from either a physician or you might have looked it up online. But these guidelines were developed by the American College of Sports Medicine, and they are endorsed by a number of different organizations. Some that you might be familiar with are the American Cancer Society, National Comprehensive Cancer Network, the CDC, and the National Cancer Institute, which is part of the National Institutes of Health. So depending on what your goal is, and that's what we'll kind of work towards when we talk about exercises, what is your goal and what type of exercise and how much of that exercise are we going to do to reach that goal? But generally what we tend to recommend for aerobic exercise, for a steady heart rate increases, running, brisk walking, jogging, swimming, biking, indoor cycling or rowing. We try to recommend 3 times per week, 30 to 60 minutes for each session. Or we do resistance training 2 times per week, and that's 2 sets of exercises, 8 to 15 reps. Okay. And then depending on what your goal is and on honestly how well you feel, you might be able to combine these 2 types of exercises. You might be able to do both aerobic and resistance training exercises within the same week. So you do aerobic 2 to 3 times per week, 20 to 40 minutes, in addition to doing resistance or strength exercises 2 times per week, 2 sets for 18 to 15 reps. Again, it really depends on what your goal is, how capable you are of doing those exercises. A lot of people say that like, oh, that's too much exercise for me, so what's the point of doing it? That's absolutely not the case. Depending on where you are in your treatment journey, you can pick which one you're able to do. And you can also modify how much you do. So I think a lot of people think with exercise that I don't have 30 minutes at one time to be able to do aerobic exercise, so I'm just not going to do it. But what we don't know or what we're not told is that it doesn't have to be all at one time. And I don't really know where that kind of came from. I think it's because people are used to going to the gym and you have that designated time. But if you don't do that and you're just doing exercise on your own time in your own setting, let's say you want to do 30 minutes of walking. If you can only do it 15 minutes in the morning before work or 15 minutes in the evening after work, that's still 30 minutes of walking that you've done in that entire day. So it's really up to you and how you want to break down the exercise that fits your lifestyle. So these are recommendations for you to try to meet, not necessarily you have to meet them to be able to, feel better. Okay. All right, so the American College of Sports Medicine did a huge review in 2019, and it looked at all of the scientific evidence and all of the research trials that have been done in exercise and cancer. And what they found is that with exercise, it can help with a number of cancer treatment-related symptoms. And these are strong evidence knowing that if you do exercise, you will feel some type of relief within these symptoms. So fatigue, I know, is a #1 symptom that I think 100% of patients and survivors always complain about, and it never really kind of goes away. It comes in waves in the beginning, and it comes in waves at the, in survivorship. But exercise, as counterintuitive as it seems, is the #1 remedy to cancer-related fatigue. The next is health-related quality of life, physical function, so your ability to kind of do things around the house or do things outside or do the things that you want to do. Exercise can help you regain that physical function better than really anything else. Exercise helps with anxiety, either that's related to your cancer treatment or your cancer-related symptoms. Helps with depression. It helps with better sleep quality. It helps with lymphedema. And for a long time, we thought exercise hurt lymphedema, but we have extensive evidence to show that exercise does not make lymphedema worse. It actually helps it. And it helps absolutely with bone health. So those who are at risk for developing osteoporosis, brittle bones, exercise is a great tool to either maintain the amount of bone density that you have or improve the amount of bone density and strength that you currently have. So in addition to those cancer-related symptoms, a lot of people think that, okay, if I do exercise, I'll just get stronger and I might have a little bit more endurance. But there's so many more symptoms that we can treat with exercise that I think a lot of people don't know about. And I think if people knew more about them, they'd be more inclined to try to exercise even just a little bit as much as they possibly can. So cardiovascularly, we know that exercise can help with improving your heart function. Any deconditioning or weakening of the heart that might have happened during your cancer treatment because of either, you were in the hospital or either because of the side effects of the drugs that you were taking, exercise can actually help reverse that weakening of the heart. Like I said, it reduces lymphedema. It improves blood pressure over time, and it improves circulation within the body. So if you have, swelling in your hands or feet, the muscle is actually one of the best pumps to kind of move that fluid away from your extremities and get it back into the cycling of your body, of your blood circulation. So exercise is a great tool for that. So like I said, exercise can improve muscle strength, specifically resistance training exercise. It improves physical function, your range of motion. So if you've had surgery that might be impinging some type of joint or has injured some type of muscle and you don't have as much movement, either you can't raise your hands, above your head, or your shoulders don't really go a certain way like they used to, exercise can over time help with that range of motion. Like I said, improves bone density and strength. And it improves balance, which I know is a huge concern for a lot of patients, especially if they have neuropathy, right? If you have any numbness or tingling that happens with a lot of chemotherapy, you tend to lose your balance, or you might trip on things that might not actually be there because you don't have the feeling in your hands or feet. So exercise is a great tool to improve your balance, to reduce falls from that. So like I said, a lot of psychosocial symptoms, fatigue, quality of life. It can reduce anxiety, improve sleep, and improve depression. And then there's growing evidence to show that exercise can help increase the chances of survival from cancer during treatment. So we're seeing longer lifespans for people who are surviving longer, and that's due to adding exercise to whatever treatment that they might be receiving from their physician. Exercise also improves immune function. So a lot of times with chemotherapy, you become immunosuppressed, but with exercise, you can either mitigate the amount of immunosuppression and improve your immune function over time. Exercise is also shown to improve treatment tolerance. So a lot of times, maybe you or someone you know has gone through chemotherapy, and the chemotherapy gets so intense over time that your physician either has to decrease the amount of chemotherapy they give you, or you might have to skip a couple of weeks because you're going through too many symptoms. But we're showing that with exercise, if you do exercise during treatment, you can actually tolerate the chemotherapy or the type of treatment that they're giving you better, meaning that you don't have to reduce the dose, you don't have to skip weeks as often, meaning that the chemotherapy or whatever drug they're giving you will work at its intended strength, and you can actually complete treatment on time, and which gives you a better chance of targeting the tumor and the cancer versus someone who doesn't exercise. And lastly, it reduces recurrence, meaning the cancer coming back. So we've shown in some studies that people who exercise regularly during and after treatment and keep up some type of exercise routine, their chances of the cancer coming back are lower than those who don't exercise or who don't incorporate some type of physical activity or exercise into their survivorship routine. So that's something you consider as well. All right. So shockingly, you may or may not know, is that we are not exercising enough. And this is not just cancer patients and survivors. I'm talking about the general public as well. We are not exercising enough. And there are a ton of different reasons why, specifically for cancer patients and survivors, we'll kind of get into that. But the number you may not know is actually quite high. So 53 to 70% of survivors actually do not meet the exercise guidelines that are put forth for them from the scientific evidence. So the duration and the amount of exercise that we talked about in the beginning, 2 to 3 times a week of aerobic training, 30 to 60 minutes, and then 2 days a week of resistance training, almost 70% of survivors are just not doing that amount of exercise. And I think one of the reasons why is that we don't, as a society, look at exercise as medicine quite yet. For those who regularly exercise and probably can attest that exercise has done a great amount for me, and it's great, and it's really helped my treatment. But a lot of people don't know because they don't have access to someone who can give them exercise guidelines and resources and guidance as well. So for those of you who, I'm assuming that if you're on this call, you have some type of belief in exercise and you see the positive exercise, or someone told you that exercise is good for you, so you join the call and you join the program. So this slide is specifically to show you how the treatment that you get in an oncologist's office, in the hospital, in your community clinic, or your physician, It can be used as a template for how we treat exercise as medicine. So a lot of times you might have heard currently or in the past, from your physician, I'm going to give you these pre-medications before you get chemotherapy. And today you're going to get 100% of the chemotherapy that we prescribe you. After chemo, we're going to send you home with these, 3, 4 medications, and these are to help you with any symptoms that you might have. When you go home, you'll come back in 3 weeks. So we're going to repeat this chemotherapy again. And then depending on how bad your side effects are and how bad you were feeling, we may change your treatment, right? So some type of that script you might have heard somewhere along the line of your treatment. And that's something that you'll hear repeatedly over and over again. So if we, in our brains, and if we tell people that we love and we want to get people exercise, this is how we treat exercise as medicine in the oncology field. So this is a script that I use a lot of times for my patients that I'm going to prescribe you 2 days of strength training. We're going to focus on your lower body because you told me that you're having trouble getting around the house. And because of the numbness from your neuropathy, I'm going to also prescribe balance exercises so that we can reduce the risk of you falling. And since it's nice outside, which it was today, we're going to add 20 minutes of outside walking 3 times a week. You'll come back in 3 weeks. We'll reevaluate how the exercises felt and if we need to change anything from that initial prescription. So you can see how they're very similar in terms of I'm going to prescribe you something in terms of dose, in terms of how many days, and then how we're going to reevaluate it. So as a professional, this is something that I say over and over again, but for you personally, I want you to treat exercise as that. These are the goals that I want to have. I want to be able to get up out of a chair without using my arms. I want to, get around the house without being afraid of falling. Or I want to, pick up something heavy or pick up my groceries without needing any help. So what is that goal? What are the exercises I need for that goal? And how many days per week and how much time do I have to dedicate during those days to reach that goal? It's the same thing with chemotherapy and it's the same thing with exercise. Okay. All right. So how do I get started? Like what do I do? Okay, you're telling me all this exercise, but what do I do? Who do I turn to? So things that I want you to consider when you're thinking about exercise is really your number one priority is safety. You have to be mindful of what your current health status is. If you're currently on treatment, it might not be the wisest to join a gym. Gyms are notoriously disgusting, and this is from someone who goes to a gym. People are not cleaning up after themselves. People are just kind of out and about and sweaty. So if you are not cleared in terms of your immune health to go out into that very public area, then find somewhere either outside, at a community center, or in your home that you can exercise safely. And there has to be, like I said, a balance between your current health status and your exercise progression. What that means is that where are you on your cancer journey? Are you currently receiving treatment? If you are, it's perfectly fine to exercise as long as you check in with your physician, letting them know that you want to start this new lifestyle change. But being aware that the amount of exercise that you do is going to be different from someone who's already completed treatment. So comparing yourself apples to apples with somebody else who has cancer is not really the thing to do. It's a matter of where you are in your cancer treatment journey that will dictate what your goals are and how much exercise you do and how much exercise you add to your daily routine. The next thing to consider is what is your goal? So a lot of people are like, I just want to exercise. Okay, that's a great point, but what is the goal that you have in mind? So is it to increase your muscle strength because you lost a lot of muscle mass? Is it because you can't do things for yourself? Either things are too heavy, and you want to lift things for yourself, you want to do things around the house, and you just don't have the muscle strength like you used to? Or is it to build your endurance? Were you too deconditioned because you were in the hospital for too long? Or is it just to, reduce the amount of falls that you have? So you want to work on your balance. You can absolutely do all 3 at the same time. But you have to have a goal in mind to be able to have a targeted exercise program. So write down those goals. They obviously will change over time as you progress with your exercise. But if you don't write down your goals or you don't have an exercise goal in mind, I tend to find that patients will be very flighty with their exercise program because they don't know what they're working towards. They'll kind of try a little bit of everything and they realize they're not making any progress at all. So then they kind of give up. and they're like, exercise didn't work for me. That's because they didn't have a consistent program to get them to a goal. And the next is to integrate exercise as part of your to-do list. So I don't know about you all, but I'm a huge fan of to-do lists. I have many, many, many to-do lists, and actually exercise is on one of them. You know, we're all very busy. And so I have to put exercise on my checklist to let me know, like, hey, I have to make time today to exercise. If I can make time to, I don't know, mow the lawn with my husband, then I can make time for 20 minutes of strength training in my house because I didn't have time to go to the gym. So it is a habit that we have to form, and it takes time, especially if you're not a regular exerciser, and that's perfectly fine. It's just a matter of how are you going to integrate exercise into your daily routine. So it's a matter of jumbling things around and making it a priority. And if it's not a priority, how do we make it a priority for you? And last, and I really emphasize this for a lot of my patients, and I will emphasize this for you as well, is to set yourself up for success by knowing yourself. So I say that is that you want to exercise and you're like, I think I will run a 5K because that's something that I see people do. If I ever said that, I'd be lying to you because I absolutely do not like running, and you will not catch me running for fun. And that's something that I know about myself. So I get my aerobic exercise in other ways, other than running. So if you know that you don't like something because you've tried it many times and it's not comfortable, then don't try to force yourself to do it, because then you won't do it. And then you'll just associate that really terrible feeling of being uncomfortable and hating what you're doing with exercise, when in fact, exercise can be very enjoyable and make you feel really great and empowered about yourself and the capability of your body. So just know what works for you. Do you need music to kind of tune out all of the thoughts from the day? Do you need the TV on to distract you from what's going on? Do you need a partner to exercise with? Do you need a different setting? Would you like to go outside? Do you want to go to the gym? So figure out what works for you and go with that. Make that work for you rather than trying to make it, you trying to make something work that you know will not work. Because that is the one way that I've seen patients be successful, is knowing the thing that works for them. All right. So now I want to go into a couple of different slides about fact or fiction. So a lot of times with exercise, like I said, there's this preconceived notion about what exercise should be. And that is often targeted towards the general population that is not dealing with some type of chronic disease, such as cardiovascular disease, diabetes, and cancer in this particular case. So these are things that you might have heard about exercise, or someone told you about exercise, and it may be true, it may be false, but really, who's to say what's right or wrong, especially if you go on the internet? Everyone's got a different opinion. So these are things that I've heard from the countless patients that I've worked with and that we have addressed, and I want to address with you. So these are specifically cancer-centered in terms of people living with and beyond cancer, what is right fact and what is fiction. All right. So the first is, I need to lift heavy weights. You probably have heard that, or someone has told you, like, if you need to make a change and you want to feel better and you want to get more strength and you want to, change your bone health, you need to lift heavy weights. I absolutely say this is fiction. Heavy is a very subjective term. Heavy for someone who hasn't lifted weights because they have been in the hospital for, weeks at a time, are on medication that affects their muscle tolerance or their ability to use their muscle. Heavy is subjective. It could be 2 pounds. It could be 1 pound. If you just had surgery, right, lifting 3 pounds might be excruciatingly heavy for you. It's a very subjective term, and it's all different between everybody. And the weight that you lift is dictated by your exercise goal. So strength training or resistance training isn't just to put on a ton of muscle like a bodybuilder. It's not to move around a ton of weight. There are different goals for strength training. And if you're part of the Happy Feet program, that is how we programmed the 7 weeks of exercise, is how do we use resistance training for building strength, for building endurance, and for building balance, right? Those are 3 things that we can definitely do with strength training. So what is your goal? And that goal will dictate how much weight that you lift. So if you're just lifting heavy weights, you're going to be neglecting some other physical fitness component and not concentrating on your goal if it's not to become a bodybuilder or move a ton of weight. And heavy lifting is good for some people, but not for all people and not for all goals. So, depending on what, like I said, your goal is, if your intention is to put on muscle mass and to build bone health, lifting heavier weights might be a prescription that I might give to you. But if your goal is to build endurance with strength training because you don't like to go running or jogging, lifting heavy weights will actually hurt you rather than help you. And I think people tend to forget is that exercise, like any lifestyle change, will take time. Just because you exercise 2 times in a week does not mean there's going to be, immediate changes. The goal is to increase your weight over time, and that's called progression. So we call it exercise progression, meaning that one to 2 weeks, we might exercise you at 5 pounds. And once you get comfortable and we see that you're not struggling, it doesn't hurt as much, and you can do, the same amount of repetitions without any exertion, then we will increase your weight, right? We don't just throw a bunch of heavy weights and expect you to change every single time you exercise. That's not how the body works. That's not how exercise works. So you have to remember to tell yourself that the point is that we will get better over time. You just have to give it some time. All right. The next one is exercise should make me feel tired and sore. This is absolutely fiction. I hate when people say this. This is such a myth. This is such a, what I think the saying is pain is weakness leaving the body or whatever nonsense that is. I don't subscribe to that, and I hope you don't as well. Soreness does not mean effectiveness, meaning that just because you're sore either the same day or the next day does not necessarily mean that the exercise was done correctly or was good for you. So some soreness may happen when you, especially if you just started an exercise program and you never weight trained before. Some soreness is to be expected because you're putting a new stressor on your body. So your body's just trying to get used to what you're giving or what you're putting it through. And as you progress, like I said, as you add more weight or you do more repetitions, your body, like I said, is now acclimating to a new environment and new stressors. So you're going to have some soreness. It's to be expected. I mean, I went rowing this morning and now my legs are a little bit sore because I haven't done that in a while. So that's to be expected. And in the next few days, it will dissipate. So if it's not going away, then that is a red flag for you to reevaluate how your exercise is working for you, or in this case, not working for you. And like I said in the beginning, if you're exercising correctly, meaning that you're doing the proper form, you're lifting the proper amount of weights, you're giving yourself time to relax and to rest, and you should feel good with exercise. You probably know this from Legally Blonde. Exercise does release endorphins and other hormones that make you feel good. And if you ever heard of like runner's high, when people go running, they feel really great afterwards. Not necessarily me, but other people who might feel that way. It's the same thing with strength training or any type of exercise. You should feel good about what you've accomplished. You should feel good about what your body was able to do and what it's capable of. And if you don't feel good after exercise, that means that you have to look at what you did during that exercise, and maybe you need to change something in that exercise program. All right. The next is running is the best exercise. So I think I've said this already. I really don't like running. So this is going to have to be a fiction for me. So a lot of times people say like, and I've heard this even from physicians who are not trained in exercise, which is not their fault. It's just not their specialty, is that, okay, well, you should exercise more. So you should go running or jogging. And that's absolutely such a blanket statement that I don't subscribe to. And I hope you don't take that to heart as well. Running is a great exercise. It's great for a lot of people and a lot of people love it. It's, very low cost, low resource, but it's not for every person. It's not for every body. So there are many, many other ways to increase your endurance. Like I said, brisk walking with weights on your body, going jogging, using elliptical, going cycling, going swimming. There's so many other ways to increase your endurance that you do not have to think that you have to go buy an expensive pair of running shoes and the tights and the shirt and, all the equipment to go running if you don't like running and you want to build your endurance. And like I said, running is okay for some bodies and it's harder on others. So a lot of times I hear this from patients that my knees can't take it. They can't take the running. And I absolutely get that. I have, one good knee and one bad knee, and running is very hard on my joints, and it's hard for a lot of people. So don't think that just because a lot of people are running and their bodies can take it, that doesn't necessarily mean that your body has to be able to withstand running. All right. The next is weight loss should be my number one goal. This is fiction. And I really don't like this recommendation. We use weight a lot of times as the overall fixer of things, like lose weight and all of these things will, be better. Weight loss does not mean improved health. And that's not even just in cancer. That's just in a lot of different chronic diseases, and in a lot of different people. So weight loss does not necessarily mean that you'll have improved health. If you watch the 2024 Olympics and the Paralympics, you can see that there are all different types of shapes and bodies that have competed in the Olympics. So weight does not dictate how athletic you are, how strong you are, or how healthy you are. So weight loss, it's more about the management of other conditions. So comorbidities such as high blood pressure, high cholesterol, high blood sugar or glucose. So a lot of times people use weight loss to manage those conditions rather than the overall disease. And one thing that I like to say with weight loss is that even if you exercise and you're moving more and you're sweating and your heart rate's up and you're burning calories according to the machine that you're using, it's not a guarantee that you will lose weight with exercise. But that does not mean that your exercise is not effective just because you're not losing weight. Weight loss is such a complicated science that people don't realize. It's not just about calories in and calories out. It's not about, the amount of time that you exercise. Those are absolutely key factors and contributors to weight loss, but it's not so simple. There's so many other different factors, such as hormones, such as medication, such as lifestyle and diet that we have to take in consideration, that I hope you don't get discouraged that once you start exercising, and if weight loss is part of your goal, not just your only goal, that if you're not losing weight, that doesn't mean that there aren't other positive physiological changes happening in your body, because there absolutely are with exercise. And like I said, your number one goal should be decided by you, not by the fact that we are told to lose weight or we have some idea that we should lose weight and it'll, be the fixer of all of our problems. So like I said in the beginning, decide what your goal is and make your exercise tailored to that goal, not to just weight loss. All right. The next is exercises only for those people who are done with treatment. And we're talking specifically about, treatment for cancer, chemotherapy, radiation, surgery, whatever have you. This is absolutely fiction. We have several studies going on at UPMC for people who are going through active treatment and are currently exercising. So exercise during cancer treatment, the goal is symptom management, meaning that, I'm feeling fatigued, I feel tired and I'm not sleeping well, or I have some, I have anxiety, I'm losing muscle mass. So we use exercise during treatment to manage those symptoms. So rather than looking to improve the amount of strength that we have and improve the endurance, what we're actually trying to do is maintain what you have. So for those of you who have gone through treatment, you can probably attest to like, oh, all of those things really declined with treatment. So what we're trying to do with exercise is make sure that the decline that happens is not so steep, right? So comparing someone who exercises during treatment versus no treatment, someone who does exercise might still have declines, but they're not going to feel it as bad as someone who doesn't exercise at all. And then for those who are exercising during treatment, it's a balance between resting during your hard days when you're feeling really terrible and your symptoms are flaring up, and then capitalizing on the easier days when those symptoms have subsided. So we're going to say, okay, I'm feeling a little bit better. Let's go for a 5-minute walk. Or, I'm feeling a little bit better. Let me do just a couple of different exercises. So it's figuring out which days are good, which days are bad, and then letting yourself use those to your advantage. And then last is that with exercise during treatment, there's really low to no risk of injury. So a lot of people are like, I'm so fragile. Or a lot of times physicians think that patients are so fragile when they're getting cancer treatment. But I have found that's really the opposite. If you're going through cancer treatment and you're getting up and, doing something every single day, whether it's exercise or just going about daily life, you're stronger than you actually think you are. And so exercise is not going to change that. And so the risk of injury is very, very low. And even in our clinical studies right now, this risk of injury is low to nothing. All right. The next is exercise can improve how effective my treatment is. This is absolutely fact. I think I talked about in this beginning. There's a lot of new research that's coming out about exercise during treatment, including here at UPMC. And like I said, exercise is for symptom management. And so if you can manage your symptoms better, that means that you can go through your treatment as planned, and you don't have to delay or reduce the amount of treatment that you get, meaning that your chemotherapy or your treatment is working at its effectiveness that your physician intended it to work, meaning that you will get through treatment quicker and you can target the tumor or whatever it is that you're targeting at a better rate. Oops. And then if you're exercising during treatment, we have shown that if you exercise during treatment, you will feel better during and after treatment. So any outcomes that you might feel better, fatigue, quality of life, physical function, muscle strength, if you continue that exercise, you will feel much, much better after treatment versus someone who's just starting exercise after treatment. So you kind of have a leg up in that sense. The next is doing chores around the house is sufficient exercise. I've heard this because I hear that from every single patient that I have ever worked with. It's like, well, I made myself a sandwich today. I went to the bathroom today. I took a shower. And those are all great accomplishments. So it's a little bit of both. Yes, it's fact. And yes, it's a little bit of fiction. Like I said, sometimes doing activities of daily living, so things around your house, doing chores, sometimes that's all you can manage, and that's perfectly fine, especially on those harder days when you're feeling those symptoms really flare up. But that does not mean that you need to limit yourself to doing just those things. So like I said, I think cancer patients and survivors are some of the strongest people that I've ever met. And they tend to doubt themselves and how much they can do and how strong that they actually are. So don't let the bad days dictate what you actually can do. Not every day is going to be a bad day. There are going to be less bad days and there are going to be some good days. And then there are times where I've had people tell me like my symptoms are worse, so I should take it easy. That's partly true, partly false. If you're feeling really fatigued, the number one prescribed treatment for fatigue, for example, is actually exercise, which is counterintuitive because we think if I'm tired, I should just take a nap and I'll feel better. That's partly true, partly false, because with exercise, there's a lot of physiological changes going on. Like I said, blood circulation, muscle movement, pumping of different channels and lessening of circulation that actually makes symptoms go away. So it doesn't necessarily mean that you need to take it easy. It's just about modifying what you're able to do and just giving yourself a little bit of a challenge to see if you can actually do those things. And like I said, take advantage of those minimal symptom days. Really sit down and think, does today worse than yesterday? Maybe not. I feel a little bit better. So let's just try one extra thing. No one's saying to go outside and run. No one's saying to go start a new exercise program. Just try something a little bit different than you did on the days that you weren't feeling so well. The next is I need to join a gym and have a personal trainer to exercise. Absolutely false. Like I said, you have to take stock of how is your immune health. If you are immunocompromised, if you're currently on treatment or your physician says that you cannot be in high traffic areas, a gym is not the place that you need to be. And not all personal trainers are actually qualified to work with cancer patients and survivors. It's not part of their training. That's not to say there are personal trainers that are qualified and have done extra training to work with people who have chronic diseases such as cancer. But those are a little bit harder to find, and they might be a little bit pricier because of their expertise or their further education. So might not be accessible to everybody. So just because they have a personal training certification and they work at a gym, doesn't necessarily mean that they know what's best for you in terms of exercise. And I think the best way to know if it's right for you is that if you have like a spidey sense tingle and you're like, this doesn't seem right for me, then it's probably not right for you. And I think one thing that's really important is that you build and select the environment you exercise in. for some reason, we have this notion that we have to go to a gym or a boutique exercise class to be able to get some type of workout, and it's absolutely not the case. Exercise where you're comfortable, and my mom exercises in her living room. You know, I exercise outside with my husband sometimes. It's really about what you do, not where you are. And we live in the year of 2024. All of you are using Zoom and the internet. There are so many resources that allow you to exercise not in a gym, and so many of them are free now, that you don't even need a subscription or need to pay for it. So there's so many resources that we can provide you. So if that's something that you're interested in and you want, please reach out to us either via the private page or through the Happy Feet program, and we'll be happy to point you in a direction to do for resources to not exercise in a gym. And this kind of pertains to the next one, using specialized equipment. There's so many effective alternatives, things around the house, soup cans, gallons of water, laundry detergent, really cheap dumbbells from Target or the dollar store. You don't need specialized equipment to get the best workout. And do not let your equipment purchase be the motivating factor to start exercising. So you probably have had a treadmill or a bicycle or an elliptical that acted as a clothes rack. I'm guilty of that. Mine's in my garage right now. So do not go out and buy an expensive piece of equipment and think, okay, I bought it, so that means I'm going to start exercising, because that has guaranteed never worked for anyone in the history of exercise. So don't let that be the motivating factor. Find something else to motivate you to start exercising. And once you become integrated into your lifestyle and you're like, I need some more specialized equipment to help further my goals, then consider starting to buy something more expensive. All right. And then I think the last one is something is better than nothing. And this is absolutely true. Movement is important, whether it's physical activity or exercise. It's just about getting up and doing something other than sitting around, which we call sedentary behavior. But also remember, rest is important. No one's saying that you have to be up on your feet 7 days a week, multiple hours during the day. You deserve rest. Your body needs rest to be able to make positive changes and for you to be able to move on to the next exercise goal that you have. And I think I like to tell this to everybody, is that don't underestimate your body's resiliency. Like I said, cancer patients and survivors are some of the strongest people that I've ever met. And what you've gone through, or what you have gone through is incredibly impressive. And you're still trying to do things for yourself. So don't underestimate your ability to exercise. I like to say, it's like, exercise is just exercise. It's not rocket science. It's meant to feel good and empower yourself. So I hope that you view exercise as that, rather than this nagging thing that's just hanging over your head that you feel guilty about, because it's not. It's meant to feel good, and it's meant to be something that you can control and that you do for yourself. All right. These last 3 slides are just resources, and I think I will send these in a different document to Jen, and she can distribute it through the email. And these are free resources that I often recommend to everybody. The first is the American College of Sports Medicine Moving Through Cancer website. So this is it's an international movement and initiative through ACSM. And if you search Moving Through Cancer ACSM, you'll go to their website and you'll find the guidelines for exercise. You'll find infographics and tables and figures to show you what's going on with the research, what's going on with exercise. And then what we really like to recommend is the exercise program directory. So I don't know if you all are in Pittsburgh or in the area, but if you know of anyone that's also outside of the area, you can actually search by state. And by either inpatient or outpatient or what you're looking for, and it'll give you qualified experts in exercise and cancer in your area. So if you're looking for a personal trainer, if you're looking for a research study, the exercise program directory has it. So this is what I recommend to everybody if you want to kind of get to know who's a specialist in your area. The next is an app for your phone or tablet. It's called Cancer Exercise. It's free. It's available for both Android and Apple. And this was developed by Dr. Anna Schwartz, who is a leader in the exercise and cancer research field and is a nurse. And it's great because it has you do these self-assessments at home, which are safe to do by yourself at home. And then based on your results and your diagnosis and your goals, it'll give you exercises to do, and it'll actually show you how to do those exercises. And like I said, I recommend this to a lot of people. A lot of people have told me they really like it. If you like having exercises on your phone and are accessible for you to do at your house. So I recommend Cancer Exercise app. And the last is the one group, which is the Oncology, Nutrition, and Exercise group. And this is located at the Penn State College of Medicine and Penn State Cancer Institute in Hershey. So that is actually me way back when, 6 years ago, when I worked at Penn State Hershey. And so this website is a really great resource, and it's all free. We have exercise videos showing you all different types of exercises and modifications. So if you can't do something because your lower body is not strong enough, or you have limited range of motion in your upper body, we give you exercises and we show you alternatives to do those exercises, all in video form with narration. We also have patient guides on nutrition and exercise, and we also have sample workout plans. So if you're like, I don't know how to put together a workout plan, you give me all these exercises, what am I supposed to do with them? So we actually have exercise plans that we've made for you that incorporate lower body exercises, upper body exercises, and core strength exercises. And there are different ones that you can follow. And we all have videos for all the exercises that we prescribe in that plan. Like I said, it's completely free. So I encourage you, if you want to exercise at home, this is a really great resource. All right, that is all I have for you.